Hello everyone, I am Dr. C. Swetha, Consultant Obstetrician Gynecologist, Unittas Multispecialty Hospital, Kelambakam. Now I'd like to discuss about Leucorrhea. Leucorrhea is a problem which is being faced by almost 30% of the women population. Sometimes this is the most common condition with which they suffer and they end up in the gynac OPD. This is also a problem which most of the women are hesitant to discuss either with their partners or even their healthcare provider. So leucorrhea is nothing but the excessive vaginal discharge. So what are the reasons for leucorrhea? So it can be either physiological or pathological. Physiological causes are almost 10%. So the people who are ending up in OPD, 10% of them have the physiological. So you should know the reasons for the physiological white discharge. It can be due to the ovulation, premenstrual because of the congestion, can be during or after intercourse, during pregnancy or lactation, and in the postpartum period, which is called lochia. So what are the pathological conditions? Pathological conditions like the vaginitis. Vaginitis is nothing but the inflammation of the vagina, or the vulvovaginitis, infection of both the vagina and the vulva. So vaginitis is most commonly because of the various bacteria and the parasites or the protozoans which intrude the vaginal flora. So there are conditions called bacterial vaginosis, trichomoniasis, candidiasis. And the others are the sexually transmitted diseases due to the gonococcal or the chlamydial infections. The other pathological conditions are the cervical causes of the polyps, cervical erosion, and genital malignancies, or any allergens or irritants, or the pelvic organ prolapse of the uterus causing excessive white discharge. So why does this leucorrhea happen? So every woman have a normal vaginal flora which is loaded with bacteria and the parasites. But these normal parasites, they release the help in the production of lactic acid. So the normal flora help in the production of lactic acid and the hydrogen peroxide. This interrupts the growth of other pathological microorganisms in the vagina. But when this mechanism of the normal flora is interrupted, then they end up in infections. So usually they present with excessive white discharge, which is foul smelling, and they have a lot of itching in the genital region. So how can we prevent it? This can be prevented by having maintaining a proper genital hygiene, wearing loose inner garments, and avoiding harsh soaps and detergents in the vaginal region. How do we treat it? We treat it based on the type of discharge and what is the pathology. So it can be treated with antibiotics, antifungals. So what could be the complications? If we don't treat this at the right time, then the patient will end up in pelvic inflammatory disease. The infection which was there in the lower down of the uterus and cervix will ascend to the uterus, body of the uterus and the adnexa, resulting in the pelvic inflammatory disease, which can cause severe pain in abdomen. So what could be the complications of vaginitis? If it is not treated at the early stage, then they can end up in pelvic inflammatory disease, so which has various other complications resulting in infertility, chronic pelvic pain, and peritonitis, tubo-ovarian abscess, and ends up in surgeries. If any of you are suffering with the above symptoms, kindly contact your healthcare provider or the nearby gynecologist for the further management and avoid complications for having a better quality of life. Thank you.